I'm Leslie Gutman. I'm the author of Equine ER, Stories from a Year in the Life of an Equine Veterinary Hospital. The book chronicles the year I spent as a fly on the wall here at Rood Riddle Equine Hospital, one of the country's top hospitals for horses, located in Lexington, Kentucky. I'm here today to give you an insider's look at the clinic's role in the upcoming World Equestrian Games, for which they are the official veterinary sponsor. Rood Riddle started out as a two-man show in the early 1980s, with doctors Bill Rood and Tom Riddle sharing one ultrasound machine. Today, the clinic is a multi-million-dollar operation that treats some of the most famous horses in the world, as well as backyard ponies and pasture pets. Let's go talk to Dr. Bill Rood about the clinic's role in the upcoming World Equestrian Games. Tell me, what does it mean for Rood and Riddle to be the official veterinary partner for the World Equestrian Games?
Well, it was an opportunity for us to diversify our practice.
Okay.
You know, we're largely a referral hospital in Lexington, Kentucky, and ambulatory veterinarians, by and large, do brood mares and foals on farms. So when the opportunity came up for the World Equestrian Games, it was an opportunity for us to develop a sport horse practice.
Okay.
And deal with the horses that would compete at the World Equestrian Games, so we could grow our practice into areas that we didn't serve before.
Okay, so tell me a little bit about Rood and Riddle and the history of the clinic and how far it's come in over 20 years.
Well, yes, Dr. Riddle and I formed a partnership in 1981, and we worked, frankly, out of a garage and then a lease space in a industrial park, 2,000 square feet for 3 years. And then we bought the property in 1984, built the hospital in 1985, and opened up February 1st, 1986, with a very small staff. And over the years, we've grown by representing the profession to the horse industry as it should be. You know, we speak to organizations, we've written, and we've been industry leaders.
So how many people work at the clinic in total?
The clinic right now is staffed with approximately 225, 230 employees. Most are full-time employees. We have 57 veterinarians, and the rest are staff. We employ 17 interns, I believe it is. And we're a full-service hospital, so depending on the department, we're staffed 24 hours a day.
And the clinic's treated some of the most famous horses in the world, in addition to pasture pets and backyard ponies. And tell just a few of the horses that the clinic's treated.
Oh, well, some of the famous horses would be Rachel Alexandra, for example. Dr. Bramlage operated on her about a year and a half ago. And of course, she was champion last year, undefeated. Firmed at one point in time. Yeah, we had Seattle Slew here.
Correct, yeah.
And Grindstone won the Derby. Our vision was to be a referral hospital, the Mayo Center, Mayo Clinic for horses. So yeah, we've treated backyard ponies, we've treated Icelandic foals, we've treated you know, the top thoroughbreds and top standardbreds in the world.
And as far as the number of horses that came into the clinic, say last year, would that be 10, 11,000?
Yeah, I would say probably closer to 10,000.
And as far as surgeries last year, would you say what, 5,000 to 6,000?
I would say 5,000 surgeries.
Okay.
That would be surgeries. That would be surgeries upon the table, you know, on anesthetized general anesthesia surgeries, and then you know, a good number of standing surgeries and whatnot. Many of those, and so 5,000 anesthetized on the table, maybe another 750 or so standing surgeries.
Okay, great.
So this is one of our orthopedic rooms, and like I said, we have 2 rooms like this strictly for orthopedics. This will be Dr. Embertson. It'll be a foal that has angular limb deformities, and he'll place a transphyseal screw on both ankles, I believe it is. We place horses into recovery stalls. We anesthetize them, and they gently lay down, and then we hoist them, place them on the tables, and then they're scrubbed, clipped, and prepped, and then brought here into the surgery room. Once they're anesthetized, prep takes 15 minutes, the surgery will take 15 or 20, and then they'll recover in 15 minutes. They have an ECG monitor, invasive blood pressure, arterial, and it's maintained with gas anesthesia, and frankly, we're waiting for the surgeon who's scrubbing, who will drape the foal and then perform the surgery. So Dr. Emerson is draping. And it's a typical surgery suite. I mean, you know, everybody's cap and gown, mask, shoe covers, just like you would expect at at the finest human hospital. And so we would average 20 to 25 surgeries like this a day, every day. We have 17 buildings actually on the property, on the campus, if you will. And the main building that we're in now it was our first surgery building, and it has 3 surgery suites and our laboratory, clinical laboratory, our stem cell laboratory, and bookkeeping in the offices and whatnot. And then we have an outpatient surgery building. We have 9 barns. We have a diagnostic building that includes a high-speed treadmill and an MRI facility. We have a podiatry in the building the furthest in the back, podiatry and an ambulatory reproduction center, and then and ancillary structures that support us.
And there's the neonate unit, right?
Yes, we have 2 intensive care units. We have an 8-stall neonatal intensive care unit, air conditioned and all the necessary things to treat foals. And then we have a 7-stall adult intensive care unit. When I started practice, Tom Riddle and I started practice, we wanted to have an interest in foals. And when we came to Lexington, foals were treated on farms, and either they lived or they died. It was almost that simple. And then in 1983, I think it is, I had a foal barn at a farm, and I visited it in the morning and came back in the afternoon, and the farm manager was still holding this foal in the corner of the stall. Just held it all day long. And I thought, I would like to build a hospital. I wanted to build a hospital where we could treat foals and keep them alive as best we could. And of course, we didn't have all the diagnostics and the tools that we currently have, but I wanted to do that. So that was really the impetus for building a hospital, was to have a neonatal facility, which we're in now here at Rood Riddle. And we're very proud of this room, and it's frankly very, very busy from January to middle of June, end of June, and then a sporadic foal thereafter. But thoroughbred foals comprise the largest part of our practice. So.
The biggest problems, so they start with those newborns that Dr. Rood just described, the ones that really need lots of nursing care. And so they're often products of a dystocia or a difficult parturition. And then from that, they go all the way up to anything that might have sepsis, infected joints. Those are probably the biggest ones. And then the other big area are neurologic problems in newborns. And so we see a lot of babies that seem to have problems with ischemia of the brain or hypoxias where they're not getting enough oxygen to the brain. And those babies will often have seizures, will be their big problem, and weakness. And so those things, a big part of the management is often what, just like Dr. Rood just described, and that is just simple nursing care. And so when they come in here, there aren't a lot of managers that'll do what the one you described did, where they hold it themselves. So we have Tempur-Pedic mattresses, and we can wedge these babies onto very, very safe protected bedding and keep them in an upright position, which is going to help protect the lungs, help them get everything moving in the right direction, and it's very, very helpful. And then when they get older, and another reason that we'll often have them here is like the foal that's behind us. This is one that's got a really bad pneumonia, a rhodococcus bacterial pneumonia with abscesses in the in the lungs. But this baby has done amazingly well, and Dr. Barr gets all the credit. She's been with it, and the tough thing is there's such challenges. Like this baby had been without a fever for 10 days, ready to go home, and yesterday it pops back up with a big fever. So the people at the farm, they're just like, till it's no more fevers, we don't want it back home. And this is the best place for it, especially if we're going to get 90 to 95 degree days. It needs it. It's air conditioned in here. It's really, really, it's got all the best things that it can have for treatment.
Tell me about some of the cutting edge procedures and diagnostics.
Well, diagnostics has grown tremendously. We've had the practice now, I guess, close to 30 years. The hospital's 23, 24 years old. Imaging, from the days when we had dip tanks, and then we had automatic processors and film screens. Now, all radiography is digital radiography or computer radiography. So in the hospital, we use Fujinon computed radiography and some digital. And in the field, everything is digital. It's the image is captured on a plate, you know, and then it's processed in the
But
computer.
it's a quick
It's
procedure,
awesome.
right?
It's immediate,
Right.
which is really nice, because in the old days you'd go and you'd take a radiograph, you'd have to develop it, then you have to see if it's what you want. Now you can just capture the image, look at it. If it's not what you'd like, you can read it. It's very quick. And then, you know, we've grown nuclear scintigraphy. You know, we use a lot of technetium, and the nuclear scintigraphy bone scan, if you will, is a huge part of our practice, as is MRI now. You know, we have a Siemens 1.5 Tesla magnet, closed magnet, and what we're learning about joints and tendons and ligaments, and seeing images that we've never seen before. So it's aided us in our diagnosis, and then to make a prognosis for the horse owner, what they can expect from the horse in the future. And then in labs, you know, we're one of only 2 stem cell facilities, privately held stem cell facilities in the United States, so we can harvest bone marrow or cord blood, if you will, and then grow stem cells to be used, and we freeze and maintain them for a number of years. Be used to treat ligaments and tendons and whatnot in horses, perhaps some orthopedics. You know, that field is it's cutting edge. It's pioneer. We don't know where it's going to go, but we know that stem cells one day will be very, very integral in how you practice veterinary medicine, and we're proud to be on the leading edge.
And is the excitement building in the clinic for the World Games?
Oh, there's a lot of excitement in the clinic. A lot of meetings to attend, a lot of planning. Yeah, and people are very excited because it's an opportunity for Rood and Riddle, you know, to showcase what we have to the world. Opportunity for Lexington to showcase what we have for the world. And, you know, it's a once in a lifetime opportunity for us.
And how many veterinarians from Rood and Riddle will be involved, or potentially be involved total?
I would say up to 20 veterinarians will be involved, depending on the day, you know, the event. You know, there won't be very many needed for the Paralympics or reining competition, but the cross country and whatnot, there could be 20 veterinarians involved.
And will there be other support staff, such as techs and things like that?
Yes. Dr. Chris Newton is heading our team. Dr. Alexandra, Dr. Fred Peterson, Dr. Hannah Wellman, and our ambulatory practitioners. And then they'll have a staff. And then the surgeons, I believe, Dr. Bramlich is involved, Dr. Embertson, Dr. Reed is a medicine clinician. So.
And it's kind of exciting because a lot of these veterinarians also have experience in competitions, so they're really bringing a breadth of knowledge.
Yes, Dr. Newton, Dr. Peterson, and Dr. Emerson have all competed. Dr. Newton at this level, frankly, Rolex level, so they bring a great deal of experience and enthusiasm. We have a fabulous staff that are caring people, people that give 110% every day, and they've together with the staff and the veterinarians, we've built a reputation, and we've been able to maintain it.